Hey guys, welcome back to another video. In this video, I'm going to be talking about the healthcare system here in Denmark. So if you are someone considering coming to Denmark, or you are just interested to know how the free healthcare system works here in Denmark. So in this video, we'll take a look at all the upsides and downsides of having a free healthcare system and how it works. So without wasting any time, let's get started. So let's start by talking about the cons and advantage of having a free healthcare system. The major advantage of having a free healthcare system here in Denmark is it is universal. That means all the citizens of Denmark and all the legal residents here in Denmark have access to the healthcare, meaning despite all your level of income or social status, all the citizens are equally treated and have equal rights to the free healthcare system here in Denmark, which is actually very nice. So it is there is no partiality between if you're rich or poor and anything like that. So that is really great. The another advantage of Danish healthcare system here in Denmark is that in Denmark the life expectancy ratio is quite high and the mortality rate in infants are very low, meaning that it's probably due to the high quality of treatment and services that they receive, which is also easily accessible to everyone. And also in Denmark, the Danish healthcare system focuses more towards preventative care, meaning that they run different campaigns about being healthy and sound, and also encouraging the citizen to be healthy, eat healthy, and that actually really helps. And people who really need help, they can seek help from the Danish healthcare system, and then that in return that reduces the cost of high medical treatments. So in that manner, it's actually really good because having a healthcare system, it's a good thing, but also the healthcare system which prevent citizens from having any diseases or being ill, that is also an excellent system, I would say. The another advantage of Danish healthcare system is the Danish healthcare system focuses more on the mental health issues. So if you are someone who's suffering from mental health issues, you can seek help right away, and it is widely available and easily accessible to everyone who needs it. You can actually also in Denmark take off your work. You can go to your doctor and tell them about this problem, and then you don't even actually have to tell your company or the boss you're working that why you are sick. You can just call yourself sygemeldt. That's what they do call it in Denmark. That means you are sick. You can take time off work, or maybe 2 months, 3 months, however time you need to get better. And in the meantime, the healthcare system will guide you and help you to get better and get back to work. The last one is the Danish healthcare system focuses more towards the patient satisfaction, and the data shows that so many Danes who receive the treatments and procedures from the Danish healthcare system are very satisfied, and they are treated with respect and dignity while they're receiving these treatments. So yeah, those are the advantages and upside, you can call it, of Danish healthcare system. So let's look at the cons or the downside of a Danish healthcare system. The major downside of having a free healthcare system here in Denmark is the waiting. You have to wait your turn. Sometimes citizens may have to wait for some certain procedure or the treatments that they need because it is publicly funded and the resources are very limited. So you have to wait your turn in order for you to get the treatment. For example, if you are someone who needs the procedure done, but there's someone else who are in front of the line, and due to the resources that are available at the hand, people cannot operate at the same time, so they have to manage the resources and get them treated who were first in line. So you just have to wait in turn. That's one of the disadvantage of having a healthcare system. It could be, it is everywhere, if you want the free stuff, you have to wait your turn. But you can also, in the meantime, if you're working and then you probably have insurance from your work, so you can actually also get use that and then get ahead in line. That's what I did actually when I got operated here in Denmark. It was very nice. I actually got scanned right away. The day I called, and the next day I got the scanning, and then the doctor said, okay, you need to have an operation. Okay. So more on that I'll explain in the end of the video. So yeah, that's one of the downside of having a free healthcare system. The another downside of a Danish healthcare system is that it is highly expensive. That is due to the high quality of equipment that is being used for medical procedures and treatments. So the it is publicly funded. That means the money is coming from the taxpayer. So that you have to pay more taxes, and normally many Danes are okay paying that much of tax as long as they receive the high quality treatment from the Danish healthcare system. Yes. So last but not the least, I think this is my personal experience of disadvantage of Danish healthcare system is because it's free. Sometimes it totally depends upon what kind of a doctor you get. Because when I was ill with my back pain and everything, I had this old man who keep telling me that like one of the 3 people in Denmark have this problem, and you just have to pull through. You have to eat your medication and maybe go for walks and eat good and lose some weight, because that was sheer bullshit. Because I was in a lot of pain. I was eating morphine and I could not work, I could not do anything, I could not drive, because when you receive morphine you just are dull, you're not yourself. So I really needed that treatment. So I actually had to call my private insurance and get the scans. And in that's one of the good things is I did that, because I got that done, and then the doctor saw that it was actually very severe, and he was surprised why wouldn't the general practitioner give me a send me for scannings. So yeah, then I got operated, and it was very nice. And it was very expensive surgery, I would say, because that surgery cost alone 800 Indian rupees in India. And that was totally for free of cost, because I had insurance. Even though if I didn't have insurance, I would have to go through this public healthcare system, but I would have to wait a bit. But in private it was really fast, and I could just get treated right away. So that's one of the disadvantage of having a free healthcare system. Sometimes you have to be very vigilant. You have to be, when you explain to your doctor, sometimes you have to be more exaggerative, say okay, you have too much pain or something. So guys, yeah, that's it. That was the Danish healthcare system. And then so if you think this video gave you some knowledge or insight into Danish healthcare system, please like this video and subscribe to my channel. I would really appreciate it, because it really helps. So yeah, thank you for listening, and I'll see you next time. Bye bye.